Thank you for having me. I guess how we fit into this idea about the cost of living is really what used to be, what is I think now called financial inclusion, but what used to be income maximisation, really. And clearly, if you've not got enough income, then the cost of living crisis is hitting you harder, and that's something that kind of ribbons through all the work that we do in terms of welfare rights and everything else. So I thought what I'd do is just take you through a whistle-stop tour of the range of different services that we offer at Citizens Advice Leicestershire, and if anyone's got any questions, they can pop them in the chat. I'll try and answer them, and also in the breakout room later on. I think what we do is we support and empower people to fix the problems and their problems. And here are some of the reasons why we do that. And the benefits of good advice are more than just about having more money to be able to spend on your day-to-day life, but all of these things as well. So we see improved mental health, improved physical health, and more secure lives for people going forwards, and often interpersonal relationships improving significantly. And just to give you a scale of the kinds of work we're doing across Leicestershire, last year until the end of 2024, we supported over 31,000 people there, with over 82,000 issues, predominantly around benefits and debt, and just shy of £15 million extra in income for those people that we supported there, including that huge debt figure of £1.3 million written off as well. And that is, of course, as everybody else across the third sector is seeing, an increase year on year, and it was 6% this year compared to the previous year for us. And the main way that people should contact us is via phone, and I'll make sure everyone's got phone lines available for them. And if we're able to help on the phone, we will. And then for those who need face-to-face appointments, we'll offer those. And we try wherever possible to do online kind of email advice as well. And we have our outreach across the city and the county in different locations as well, where we're trying to we're in food banks, for example, and other community venues where we know that people are really at pinch points, and trying to support them to get up the stream and stop them falling in, so they aren't reliant on kind of emergency food handouts or similar. This is in the city, so we continue to run a full service advice service in Leicester City Centre, and the same in the county. And interestingly, similar numbers of clients being supported across both those two services. And both those services will signpost into specific stuff if we can't help you there. So some of the specific services are coming up, but just before, here's our brilliant, actually Akila is in this photo here, but she's one of our brilliant volunteers, and we have they also provide advice and often some of the support around form filling, right through to really detailed advice face to face in booked appointments that can last multiple hours for clients there. This is a case study, but I mean, this was specific, and this is, I guess, pertinent today because of the recent announcement about the rise in the price cap for energy costs. But we have an energy specific service that we run, and this is an example of the sorts of work that does here. And why advice, I guess. So I think this is quite interesting about 8 in 10 people saying their problem was solved, and 9 in 10 people saying they found a way forward. And I guess that's what we're here to do. We're here to empower people to move forward in their lives and give them the knowledge and the tools they need to be able to go and make choices elsewhere in their lives, knowing that they've kind of that paperwork, that bureaucracy, and their income is much more secure. So here are some of the specialist things that we are also able to offer across Leicester and Leicestershire. We run, actually, this one's across the whole of the East Mids, but this is for people who have sickle cell and thalassemia. And this that's a really specific service, but it takes, and alongside our Macmillan service there, which is for people with terminal diagnosis, it means that when people are battling these really tough health conditions, they don't have to worry about their paperwork, and they can focus on enjoying and the end of their life, and planning for the social stuff, not the financial stuff there. And both these services prove really effective in supporting people who are suffering from those conditions. We get some great feedback from both of those. Help to Claim is a national scheme, which is where people are first-time applicants for universal credit. It supports them from applying right through to when they get their first payment, and making sure that that's the proper and full first payment that they are entitled to. There's some I mean, it's a very busy service, as I'm sure you can all imagine, especially as we've transitioned away from legacy benefits. But it's really important that those first payments are right, and people are able to anticipate what they should be, and be able to manage and plan for their income going forwards, that is correct for their entitlements too. Multiply ends at the end of March, but that's been some really that number's out of date actually, but that's been some brilliant budgeting work that's really helped people, once we've maximised their income, plan how they spend it better, so that they are able to stay out of debt, or to prioritise the right bills to be paying, and those sorts of things. I'm really recently, as in it started at the 1st of February, but it's a continuation and an expansion of our energy work. I think anybody who's seen that awful announcement in the news today will know that this is a real growth area, and there are more and more people, vulnerable customers, but also just everybody, most people I know, worried about their energy, and the more energy you use, the more you're going to be hit by the rises in the price cap going forward. So we're really pleased to be able to continue that specific service going forward. You've got Bruce coming up to talk about the great work in food banks, but we run outreach in Hinckley and at Lutterworth, and I think in total that's 9 or 10 sites we run that outreach advice from. And then pension is supporting people over 50 to make informed choices and explain around pensions, because they're a whole nother minefield for people, so that they're able to make decisions going forward about how they want to spend their later life and their money in their later life. And this is one of our services that comes under the most pressure, money advice. This is our debt specific, our in-depth debt work. So many of our clients are increasingly having their lives completely blighted by debt. This is a very much a swamped service, really, and we'd love to do more of this sort of work. Yeah, so this is our money advice service. And just such a fantastic team who are working in this service. But what I'm always really shocked by is that 50%, over 50% actually, of the people who come to us for debt advice, even after we've maximised their income and supported them to move forward, are still in negative budgets where their income and their outgoings just don't match. So they continue to be in the red every month, or to be making cutbacks to what we'd consider to be quite a harmful level in their essential spending, and that really scares me. And I think this is a real problem area and a real growth area. But we know that the earlier people can access services like money advice and other debt specialist support services, the better their outcomes can be in those situations. This is the main thing, I guess, for anybody who needs to talk to us, or any of people, the clients and people that you're working with in your communities that might need to contact us. There's loads of ways that you can do that, and I'll make sure that these get shared around as well.